To a screeching halt. You have to understand, I'm a hustler. I'm a legit entrepreneur. I sell things. I come in contact with people all the time. I have to stay safe. I didn't have a choice but to trust the vaccine. Because if you live the type of lifestyle that I live, you out here in these streets and you hustling, an entrepreneur like me, why not do it safely? So I want everybody to take this seriously. Take a shot at staying healthy. Get the vaccine.
This country needs everyone to get this vaccine, right? Or at least a certain percentage of people to eventually get to herd immunity.
So last year, Mayor Lightfoot gave 60% of our COVID relief money to CPD. We are here to make sure that this does not happen again. We are here with a clear message from Mayor Lightfoot: rescue our communities and not the big banks. Right now, Chicago is sitting on more than $1 billion with a B dollars of COVID-19 relief money that could be spent tomorrow to support our communities, but you have been sitting on it for months. Earlier this year, the White House and Congress passed billions in federal relief funding for communities across the nation. We heard President Biden loud and clear that these funds are meant to provide direct relief to Americans who have been struggling with a global pandemic and an economic crisis. But right now, Mayor, you have indicated that you want to use some of this money to plug a budget gap. And yet just yesterday, you said you wanted to raise an already bloated police budget. Today we are saying clearly with one voice, Mayor Lightfoot, do the right thing. People are out here dying. They are in fear of being evicted. They are in fear of their utilities getting cut off, and they are being forced back to work with no child care money. So what are you waiting for? Why are you sitting on this money? Why are you sitting on this money? Why hasn't it gone out to communities yet? We need an answer.
Here's your answer. We have a budget process in this city, and the budget process dictates how we spend the money. We don't allocate, I don't write a check and allocate money. The monies have to go through and be allocated by City Council. Our budget process has begun. We will be introducing a budget ordinance in mid-September that will then be debated by the City Council and hopefully pass by the end of October. So at that point, after there's rigorous public debate, and analysis by the City Council, we will be allocating those ARP dollars, part of the allocation for our 2002 budget.
Blue states got their bailout, and now cities, like Chicago, want to use the money for a universal basic income program. Grady, how much of the federal aid will be used to write those checks?
Well, it's just about 2% of the $1.8 billion Chicago is expected to get. But, Stu, that amounts to around $30 million. And many Republicans say this package shouldn't have passed in the first place because it essentially amounts to, as you said, a blue state, or in this case, a blue city bailout. The Illinois
Coronavirus is a deadly coughing disease that hangs about in the air and is passed from person to person. You must always stay alert, and if you feel like you can sense coronavirus, get indoors, fast. If you're away from home, drop face first to the ground. In this position, the only cavity exposed is the anal duct, and that should not pose a problem so long as you're wearing trousers. When you're back inside, clean your hands with a strong disinfectant, and stockpile as many antibacterials and toilet rolls as you can. You'll be needing these. If you don't have an indoor toilet, cut a hole in your favorite chair and stick a bucket underneath. If you don't have chairs, dig a hole for yourself somewhere inside the house. During a coronavirus outbreak, anyone you see could be a carrier. This includes your teacher, your local policeman, even the nice couple you meet down the park. You'd think you'd always be safe with nice men like these who like to hang around children's playgrounds. This man looks nice.
I'll bet you can't catch me.
But look a bit closer. He's a carrier. You probably feel safe inside a car, but even a car can be a carrier. If you cough on a car, that car becomes a carrier, which is why scientists now sometimes refer to the coronavirus as the car owner virus.
Hello, young lady.
This girl doesn't know it, but if she gets into the car, she'll become a carrier.
No, thank you.
Janet, would you like to know why you shouldn't have gotten into that car? It could have put you in great danger.
You mean sort of like when Johnny hits me and pulls my hair when we have a row?
No, it could have given you a deadly virus.
You mean do something rude to me?
No, not like that either, but you should go home now before you cause any more trouble. Carriers come in all shapes and sizes, so it's important when you're out and about to note down anyone you see coughing or wheezing. When you return home, immediately call the police and notify them of any person you've seen who you think is or might be a carrier. It's actually unlikely that coronavirus will affect us for at least, I'd say, 50 years. And it's important to remember that the world will be very different in half a century's time. Nursing, for instance, will be almost unrecognizable. They certainly won't be muddling around with these old gadgets. We expect hospitals will look something like this. And our world leaders won't be human beings. They're more likely to look like this. Ultra-intelligent supercomputers, processing vast quantities of information faster than any human mind. So with these men in charge, coronavirus should be stopped in its tracks in no time. Are you ready, Hugo?
We're all set here, sir.
Delta's different. Delta is not your COVID-19, it's COVID-21.
Tensions rise as we enter the 213th week of lockdown.
A grim new reality emerges.
COVID-23 has mutated.
Beginning thermal scan. Thermal scan normal.
A horrifying new development
New
today.
data confirms the virus attacks the brain tissue.
Worldwide death toll rises to over 110 million.
All infected Americans are being forced into quarantine camps.
And it's nearly 50% more contagious than the most contagious virus we've ever seen in a generation. The old way with COVID-19 of wearing just one simple mask and being in a crowded environment doesn't work for Delta. Delta is far more contagious.
The World Health Organization tonight acknowledging it simply does not know if those who've had coronavirus would have immunity or if there's a chance you could get it more than once. A top official says we simply do not know.
So right now the information is mixed. We need much more information from recovered patients.
And in South Korea, a small study showing people testing positive twice. Authorities say they don't know if it's a reactivation of the virus in their body or a new infection. But here in the U.S., authorities remain hopeful that once you've had it, or at least been exposed to it, you might have some immunity. Here in California, there are now multiple trials underway to test for those antibodies, telltale proteins in the blood that show exposure to the virus. But the CDC remains concerned about the accuracy and reliability of antibody tests.
Yeah, thank you.
And one clinician administering these new tests says it's possible immunity could weaken over time.
A lot of people say that the antibody test is the panacea for this virus, but you're saying it's not quite.
From what we've seen, we don't know.
If the antibodies disappear after a certain period of time, we believe that means theoretically you lose that immunity.
You could be susceptible to a second infection.
You know, for the last 7 days, the hospitalization rate for our region has remained above 23%. That means more than 23% of the patients in local hospitals have COVID. Remember, the governor's orders say we have to remain below the 15% threshold for 7 consecutive days to roll back capacity limits. Clearly, we are nowhere near that point just yet. And when we look at cases county by county, we can see why hospitals are overwhelmed at this point. More than 3,000 new cases were reported in Tarrant County yesterday. Dallas County seeing much of the same. More than 2,800 new infections. Collin County has reported 638 cases, and Denton County now reporting 459 new coronavirus cases. Among the new infections reported is Dallas County's first case of the highly contagious COVID-19 variant that's believed to have been originated in the UK. Dallas County officials say the patient with this new variant is a man in his 20s who has not traveled outside of the country, which means this new variant could have been here long before he was diagnosed.
Well, today we learned that new cases and hospitalizations are slightly higher than they were a year ago in the summer of 2020. The other bit of stunning data from the CDC, about 35,000 vaccinated people per week are coming down with what's called breakthrough infections. But as a reminder, that's out of 164 million people who are fully vaccinated.
The CDC now warning that vaccinated Americans can transmit the Delta variant as easily as those who are unvaccinated.
vaccinated. But the agency also says that 97% of those hospitalized with COVID have not been vaccinated. This as the virus rages out of control, especially where vaccine rates are low.
Delta can spread as easily as chickenpox. How alarming is that for you?
What it means is that anyone who's not been vaccinated yet or not recently infected, there's a high likelihood they're going to get COVID over the next few weeks.
The CDC's cause for concern evident in a new report released today, which examined a cluster of COVID cases in the Massachusetts resort community of Provincetown, all traced back to celebrations in early July. Of the 469 positive cases, 74% were vaccinated.
As bad as this is, I worry it's going to get worse as the school year opens.
The worry is already being felt in Decatur, Georgia, where classes began on Tuesday. 9 students and 5 staff members at a charter school tested positive for COVID. Now more than 100 students are in quarantine. In Florida, new COVID cases topped 17,000, numbers the state hasn't seen since the winter surge. But today, the state's governor remained defiant.
There will be no restrictions and no mandates in the state of Florida.
In New York, masks will be mandatory when the stage is set for Broadway to reopen in September. Theater goers need to prove they've been vaccinated. That's also the case at the huge Lollapalooza Outdoor Music Fest, now underway in Chicago.
Vaccination card in your hands, folks.
Even with the new precautions, few are wearing masks.
And in those internal CDC documents, a recommendation that masks be reinstated unilaterally across the country, not just in those COVID hotspots, but the CDC has yet to make that official.
In the coming days, the CDC and Biden administration are expected to announce new guidelines for people in the U.S. who have been fully vaccinated. One part that's expected, small groups allowed indoors.
Small gatherings in the home of people, I think you can clearly feel that the risk, the relative risk, is so low that you would not have to wear a mask.
The announcement was expected tomorrow, but now may be on hold, according to published reports. NBC News is checking with the CDC on its plans. It comes as the White House has been pushing back against governors in Texas and Mississippi, moving to fully reopen their states and get rid of mask mandates.
The last thing we need is Neanderthal thinking that in the meantime everything's fine, take off your mask, forget it. It still matters.
This is a guy who ran for president saying he was going to, quote, shut down the virus. And what has he done? He's imported more virus from around the world by having a wide open southern border. You have hundreds of thousands of people pouring across every month. And it's not just from Mexico. In fact, it's rarely from Mexico. You have over 100 different countries where people are pouring through. Not only are they letting them through, they're then farming them out all across our communities across this country, putting them on planes, putting them on buses. Do you think they're being worried about COVID for that? Of course not. So he's facilitating. Who knows what new variants are out there? But I can tell you, whatever variants are around the world, they're coming across that southern border.
A Texas border county declaring an emergency over the surge of migrants testing positive for COVID. It's the largest city, McAllen, building temporary tents now to house them. They just started popping up right in the middle of the city. This comes as we learn more than 7,000 COVID-positive migrants have been released into the city since February. 1,500 of them in the last week alone. What about Title 42?
What we're seeing is communities across the border declaring these emergencies, and it's no surprise. When you have over 210,000 illegal apprehensions in 1 month alone, that is astronomical. And what we see is what they're doing is that catch and release. So they're having mass releases in these communities, letting these individuals go, and then it's on these communities to provide the transportation, the public safety, and all the social services for these individuals. So of course they need these states of emergency. They need additional funding from states. And this is why the governor of Texas, Governor Abbott, is taking such measures, because the federal government is not enforcing the rule of law on that border today.
So you got 7,000 migrants, 1,500 test positive with COVID-19. Some are getting free vaccines, which, by the way, is a magnet. Oh, my goodness, I can't get a vaccine in my country. When I come to America, I'll get housing, health care, and a free vaccine. But some are turning them down. Yeah, here's the DHS on whether they'll give a vaccine to migrants, which they're considering doing. We're talking about not seeing around the corner and how this will be a magnet. Here's the quote. We continue to monitor and reassess COVID-19 protocols. At this time, our protocols have not changed, which means if you test positive, they give you a hotel to stay in and quarantine. Do you really think they're doing that?
Is simply because they've gotten caught. They've gotten caught over the last several months in trying to answer questions of why are you letting individuals go that are not vaccinated and perhaps COVID positive, and they can't answer that question. So now a lot of these migrants will not take the vaccine and will continue to be released into communities every day, and that's simply the wrong approach. But we are addressing the symptoms of the issue. What the Biden administration should be doing, and they're not doing, is actually stopping these individuals from coming to the border in the first place.
You just said there is no wall high enough and no ocean wide enough to protect us from the virus. So what is the thinking behind letting untested and unvaccinated migrants cross the southern border into U.S. cities in record numbers?
We have not withdrawn the order that is sometimes critical or criticized, saying that unvaccinated people should go back across the border. But unaccompanied children is a different story, because that's the most humane thing to do, is to test them and to treat them and not send them back alone.
And so he's not shutting down the virus, he's helping to facilitate it in our country. Is he wants to have the government force kindergartners to wear masks in school. He doesn't believe the parents should have a say in that. He thinks that should be a decision for the government. One of the major medical people in his administration just recently told parents that they should be wearing masks at home when they're around their own children. This is insane. Joe Biden also believes that vaccination should be mandated by force of government and that you should have to show vaccination status to be able to participate in society. Now, Florida, we're very proud of our Seniors First strategy. You look at the mortality in nursing homes among seniors, it's declined dramatically. But we said from the beginning, we're going to make it available for all, but we're not going to mandate it on anybody. That's ultimately an individual's choice to be able to do it.
While Mr. Biden said he would be willing to get a vaccine, he would not require it for all Americans.
I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power, just like I don't think masks have to be made mandatory nationwide.
So his vision is, just like in New York City, restaurants should ban young kids from being able to go in because they're not eligible for vaccination, and law-abiding citizens have to produce proof of their medical records just to go to the gym or attend an event or just to participate in everyday society. And so I think the question is we can either have a free society or we can have a biomedical security state. Joe Biden suggests that if you don't do lockdown policies, then you should, quote, get out of the way. But let me tell you this. If you're coming after the rights of parents in Florida, I'm standing in your way. I'm not going to let you get away with it. Florida, if you're trying to restrict people, impose mandates, if you're trying to ruin their jobs and their livelihoods and their small business, if you are trying to lock people down, I am standing in your way, and I'm standing for the people of Florida. So why don't you do your job? Why don't you get this border secure? And until you do that, I don't want to hear a blip about COVID from you. So it's a question of, do these unelected agencies have the ability to do this without any legislative authorization? And I think in a constitutional system, the answer has got to be no. And I think that they overstep their bounds on that. And I do think they overstep their bounds, of course, with the cruise ships. But we are not supporting doing any vaccine passports in the state of Florida. No one was more aggressive about getting this out. If you look at all the different points throughout Florida, whether it's a hospital, county health department, a retail pharmacy, a drive-through sites, church sites, all this stuff. It's important, but we always said we want to provide it for all, but mandate it for none. And that was something that, while it was advised to take, particularly if you're vulnerable, we were not going to force you to do it. So there was never under discussion any mandates to take vaccines. We will not have COVID vaccines mandated in Florida. The flip side of that, though, with these vaccine passports is it's completely unacceptable for either the government or the private sector to impose upon you the requirement that you show proof of vaccine to just simply be able to participate in normal society. You want to go to a movie theater? Should you have to show that? No. You want to go to a game? No. You want to go to a theme park? No. So we're not supportive of that. I think it's something that people have certain freedoms and individual liberties to make decisions for themselves. I also wonder, it's like, okay, you're going to do this, and then what, give all this information to some big corporation? I think this is something that has huge privacy implications. It is not necessary to do. You know, we're going to have hit 3.5 million seniors that have gotten shots sometime this week, likely 75% of seniors. It's important to be able to do it, but at the same time, we are not going to have you provide proof of this just to be able to live your life normally. And I'm going to be taking some action in an executive function, emergency function here very shortly.
Governor Ron DeSantis signed a bill targeting people running pandemic scams. It prohibits people from trying to profit by lying about the authenticity, effectiveness, or availability of personal protective equipment. It also says people can't make money by offering access to a vaccine for COVID or any other pandemic disease. The law allows Florida's Attorney General to shut down websites or other media platforms providing false information about the vaccine or fraudulently selling PPE. Katie Johnston.
Right, well, Wolf, we have a statement from Governor Ron DeSantis' office explaining that after he had already threatened to withhold funding from school districts that have mask mandates, now he's threatening to withhold the salaries of superintendents and school board members, school officials in these districts where masks are required. And the statement goes on to explain that they want to narrowly tailor this financial consequence to the decision makers, the people in charge of creating these rules for the students in those districts. And I want to read a part of the statement to you that says, education funding is intended to benefit students first and foremost, not systems. The governor's priorities are protecting parents' rights and ensuring that every student has access to a high-quality education.
But now for the chaos and the confusion that's coming out of the White House and the CDC, they are guilty of medical malpractice. May 13th, a number of us were with the president in the White House when the CDC and the president both announced that you no longer need to wear a mask indoors or outdoors if you have been vaccinated. The president took off his mask. The 6 of us Republican senators who were meeting with him took off our masks. But now what we have is a flip-flop by the administration and the CDC to say even if you are vaccinated, you need to go back to wearing a mask indoors. How are you going to encourage people who have not been vaccinated to get vaccinated if the message to them is even if you're vaccinated, you still need to go wear a mask indoors? That's why people at home are concerned, angry, there's anxiety, because if the White House has flip-flopped on this, are they going to flip-flop on shutdowns? Are they going to flip out on lockdowns, on closing schools? Parents are very concerned about the fact that many kids across this country have already lost a year of learning, setting them back significantly. Parents want to make sure that schools are opening, and they can't tolerate this sort of indecision on the part of the administration. The contrast is significant when you take a look at Nancy Pelosi telling the Capitol Police to arrest fully vaccinated staff members if they happen to be on the House side of the Capitol and aren't wearing a mask. And at the same time, at the southern border, you have 180,000 people coming in undocumented, unvaccinated from all over the world, carrying some of the most incredibly contagious diseases in the history of mankind. The White House on this and the Center for Disease Control have lost all credibility.
The number one thing that we can do to support our local businesses is get out of their way.
That was Texas Republican H. Scott Appley in 2019, before the pandemic came along and he became a raging critic.
That's right!
Praising mask burnings, calling a health official promoting vaccine an absolute enemy of a free people, and last Friday echoing a claim vaccines don't really work anyway. But just after posting that, according to a GoFundMe page set up for his family, Appley was admitted to a hospital, diagnosed with COVID, and by Tuesday, he was dead. One-time presidential hopeful Herman Cain, who downplayed masking at one point before he went to a crowded Trump rally unmasked last summer, developed COVID symptoms and died. In Tennessee, conservative radio host Phil Valentine joked about the virus this summer. Then it nearly killed him and left his brother pleading with the public.
We want as many people as can hear my voice this morning to put the politics aside and go get the vaccine.
In Louisiana, Republican Luke Letlow died of COVID in December, weeks before he was to be sworn into Congress. He wanted the vaccine. It wasn't available. Now his wife, elected to fill his seat, can't believe others still won't take it.
I would have given anything. I would have given everything for that shot to be available for us. I mean, looking back now, and for someone to turn it away, it's heartbreaking to me.
Still, a recent poll found nearly a third of Republicans insist they will never take the vaccine, even as other people like Travis Campbell, who just didn't get around to getting the shot, is also begging from his hospital bed for everyone to get on board.
So please, for the love of God, if you really want to have a chance, don't fall numb to all the TV, Roderick, and social media. Just protect yourself.
Millions of shots now administered every day as it continues to struggle with infections believed to be driven by the Delta variant. And now India's health ministry is telling state governments it has found 40 cases of a Delta mutation, Delta Plus. India is classifying it as a variant of concern, possibly more transmissible and more resistant to a particular COVID-19 treatment. The Delta Plus variant is a mutation of the spike protein on the virus called K417N. It was also found on the beta and gamma variants, which first appeared in South Africa and Brazil. The Delta Plus mutation was first reported by public health authorities here in England earlier this month. The first known case was taken from a sample in India in April, at the start of its brutal second wave. Many experts say it's too early to say if this mutation is a greater threat than Delta alone. Many more cases need to be analysed before we know if it affects transmissibility, disease severity, treatments or vaccine effectiveness.
I would be, really surprised if in the next week, or couple of weeks, we don't get more information.
Fewer than 200 cases have been identified outside of India, including at least one in Canada.
In a country with a population of more than 160 million, fewer than 3,000 have been tested for the virus. That's one of the lowest testing rates anywhere. Many hospitals all over Bangladesh are turning away patients, even the critically ill, because of fears of coronavirus infection. Bangladesh's health minister has issued a warning to healthcare professionals.
This is not the time to backtrack on your duties, and it is not justified at all. Stand by the people and serve them. Recently, we have noticed the dereliction of duties.
Media reports here say more than 50 Bangladeshis died recently from respiratory illness, symptoms similar to coronavirus. But the government didn't record their death as virus-linked, the report said. A recently leaked UN memo warned that Bangladesh is facing up to 2 million deaths from the pandemic if immediate and appropriate steps aren't taken.
After bringing the COVID-19 outbreak within its borders largely under control, China is now battling its worst outbreak in almost a year, as cases continue to emerge in the northern part of the country. Health authorities reported 118 new coronavirus cases on Tuesday, 43 in northeastern Jilin, a new daily record for the province. Infections were also confirmed in Heilongjiang and Hebei province, which surrounds Beijing, the Chinese capital, which itself reported one new case. This new wave of the virus is causing concern, especially as the Chinese New Year or Spring Festival holiday approaches. Millions have been placed under lockdown, and cities have issued advisories telling people not to travel to their hometowns this year. Health authorities reported the case of an asymptomatic super spreader in Jilin province who was linked to over 100 infections. This comes
Chinese state media calling it the worst outbreak since Wuhan. Officials mobilizing across China to stop the rapid spread, linked in part to the Delta variant. A handful of confirmed COVID-19 cases surfacing from Shanghai to Beijing. Worrisome given China's zero cases focus.
Here in the capital city, you have tens of thousands of residents under strict lockdown. This is one of those communities. The reason we're not getting out is to not expose ourselves to what is a lockdown neighborhood. Behind these barriers, you have folks who are abiding by the stay-at-home orders and who are once again having to undergo mass testing. The warning from officials is eerily reminiscent of 2020.
A Beijing government spokesperson vowing to block the virus from spreading further within Beijing at any cost. It's leading to a halting of travel in China's capital from affected areas, the list of which is quickly growing. Among the cities with new outbreaks, Wuhan. After roughly a year of enjoying life near normal, the original epicenter of the coronavirus outbreak is now testing each of its more than 11 million residents. Families canceling summer travel plans, opting instead to stay home. Several communities sealed off. Thousands taken into government quarantine for observation. The lockdowns, the mass testing, strict contact tracing through smartphones, all being enforced once again.
It might all sound extreme, but China's domestic containment efforts, along with its tight border restrictions, seem to have been working. Aside from a few isolated cluster outbreaks, life here had mainly returned to the way it was pre-COVID.
But officials say a commercial flight from Russia changed that. The plane landing in the eastern city of Nanjing on July 10th, suspected of carrying the highly contagious Delta variant. On July 20th, officials confirmed Nanjing airport workers subsequently tested positive. 2 days later, thousands of tourists visiting the central Chinese city of Zhangjiajie crowded together to watch live shows. It's believed some of those attending had been infected traveling through Nanjing. Cases then surfaced in several major cities and have since spread to dozens of others. As of Tuesday, the virus has been detected in 16 provinces across China. It is the greatest test yet of China's post-outbreak containment efforts and puts into question the effectiveness of Chinese-made vaccines against variants like Delta. While the official number of confirmed cases is still in the hundreds since July 20th, all of the airport staff in places like Nanjing were reported to have been fully vaccinated with Chinese vaccines. Still, many got infected. Even more concerning, several of those sickened are reported to be in severe condition. It has sparked uncertainty and panic buying in some cities. Grocery store shelves quickly emptying as folks prepare for this latest outbreak to worsen and new stay-at-home orders to take effect. This latest outbreak coinciding with the countdown to the 2022 Winter Olympics. Beijing gearing up to host the World, the Games scheduled to start in 6 months. The spectator infrastructure is in place, but this new variant threatening to leave stands near empty for yet another pandemic Olympics.
We're seeing images like these of people flocking to the stalls to stock up on food and supplies. Now, they are afraid Wuhan will impose another lockdown like the one back in January of 2020, one of the strictest on the planet, and certainly the first.
Becky, we'll look first at these travel restrictions. A lot of these focus around where I am right now. It's Beijing. It's about protecting the capital, what's been described as a fortress if you go back to the initial outbreak more than a year and a half ago now. And one of the officials who spoke just in the past couple of days said that they will protect Beijing at any cost. And what does that mean here on the ground in China? It means that those who are in affected areas deemed medium and high risk, and that's a designation given based on potential exposure or confirmed cases in those locations, they cannot travel into Beijing. They're restricted by train and by plane from actually flying or traveling in any way. And they'll be able to monitor a lot of those folks through the smartphone QRs that we really get around with here. And they can change colors and put you in different designations as to potential quarantine or just to get tested. Either way, the focus is on keeping Beijing safe and many other cities right now because it's widespread. You mentioned Wuhan, the original epicenter. All of this is just so eerily reminiscent of the conversations you and I were having more than a year and a half ago now, and the discussions of a potential lockdown there. Well, right now they're doing the mass testing. This is actually the second round that they have tested the entire population of more than 11 million people. And they do that mostly through pool sampling so that they can then narrow down if one pool, for example, of 20 individuals is positive, they'll go one by one. That's what they've been doing in multiple cities. It's not just Wuhan. In Nanjing, where this outbreak that we're talking about right now is believed to have started via the Delta variant and an imported case from Russia, well, they too, 9 million people going through multiple rounds of testing of everyone in that city. But what you notice is people don't need a policy change here. They will simply start putting on the masks if they start to feel uneasy, uncertain, and doubt that anything is going to clear up anytime soon. And that seems to be the trajectory we're on as of this moment.
It's a new way to expand testing for COVID-19, a way that Dr. Anthony Fauci says may be the key in greatly slowing or stopping the disease's spread. Unlike traditional COVID-19 testing, where one person is swabbed and tested individually, pool testing combines up to 10 people's samples into one test with one result. If it comes back negative, the entire group is clear. If it comes back positive, the group's members would then need to be retested individually. Dr. Fauci says pool testing is significantly more cost-effective and efficient, saying it could result in 10 times more daily testing than the current rate that the U.S. is able to do now.
The U.S. Food and Drug Administration has now authorized COVID-19 pool testing. Now, this move will allow multiple people to be tested at once. The agency announced an emergency use authorization for Quest Diagnostics on Saturday. The company can test up to 4 individuals at once for the coronavirus, and the FDA commissioner said sample pooling is an important step at helping get COVID-19 tests to more Americans more quickly while still preserving testing supplies. Now, this is the first COVID-19 diagnostic test in the United States to be authorized for use with pool samples.
Wait, did China really force some U.S. diplomats to undergo anal swab testing for COVID-19? The constant headbutting between the two countries is probing new lows in this latest dispute. So let's try to get to the bottom of the matter. U.S. media reports said the dastardly Chinese had recently subjected American diplomatic staff to undignified rectal probing with cotton swabs in the name of pandemic control. The U.S. State Department was apparently very sore about this outrage of modesty and lodged a protest directly with the Chinese Foreign Ministry. The State Department had never agreed to this kind of testing, it was quoted as saying. Employees have now been instructed to tell people to back off if asked to undergo such humiliation and degradation. Words like Vienna Convention on Diplomatic Relations were bandied about to amplify the indignation of the purportedly offended party. What's more, according to these reports, the Americans had received assurances from the Chinese that diplomats were exempt from this kind of testing, and whatever happened had happened in error. China's side of the story was a blanket denial, with the Foreign Ministry saying it had never required U.S. diplomats to bend over for below-the-belt testing. The thing is, rectal swabbing for the coronavirus has been underway since the beginning of the year in some Chinese cities that have ramped up screening for hidden infections among high-risk people, including arrivals from overseas. It's more reliable than nasal swabbing because traces of the virus remain longer in fecal matter than in the respiratory tract. At the same time, China has decided that mass testing of this type would be too inconvenient, and a national rollout is not necessary. For the morbidly curious at heart, if you must know, the process involves a cotton swab 3 to 5 centimeters long being inserted in one's rectum and gently rotated for 10 seconds of sample excavation. Those at the receiving end have described it as a quick and painless experience, but also very awkward.
Things, China is now irking foreign visitors with its anal swab tests for COVID-19. The checks, as offensive and indignified as they sound, are required at Beijing, Shanghai and the port city of Qingdao for some international arrivals. Now, the checks, which are in addition to nasal or throat swab tests, have stoked debate over their necessity, along with apparent complaints of inconvenience and even psychological trauma. Early this week, Tokyo complained about the tests on some Japanese travelers to China, saying they had caused great psychological pain. Last month, reports cited a State Department official as saying U.S. diplomats had been subjected to these tests. A Chinese Foreign Ministry spokesman said that, to his knowledge, such tests had not been required of U.S. diplomats in China. In a statement, the ministry said the virus prevention and control measures China was taking were based on science. Some Chinese doctors even justified the tests by saying that such tests can ensure infections are spotted since the infection, coronavirus traces that is, can be detectable in the anus for longer than in the respiratory tract. Says that a positive result does not necessarily mean that the person tested can spread the virus. Now, anal swab tests are not exclusive to foreign visitors. During China's last major round of infections in January, some cities performed them on unspecified segments of the local population as well.
On the first issue about the anti-vaxxers, I think it's fair to say that there are really two categories of people. One are the people that don't want to receive the vaccine at all, under no circumstances. Are they interested in it? That's their choice. This is not going to be a mandatory campaign. It will be voluntary. There may be some restrictions that may be placed on people that don't have vaccines for travel purposes, to be able to go to theaters and other places. But that will be up to the individual person to decide whether they want to receive the vaccine to be able to do these things or not. But it is voluntary.
That Canada is about to change its guidelines on mixing and matching second doses of COVID vaccines. The National Advisory Committee on Immunization set to approve the interchangeable use of AstraZeneca, Pfizer-BioNTech, or Moderna shots in certain situations. But Manitoba officials are not waiting. They are already making the change to the province's vaccine rollout.
If you are someone who received a first dose of AstraZeneca, it means that we'll be recommending that your second dose be with an mRNA vaccine, either Pfizer or Moderna. It will be your turn when you meet provincial eligibility for second doses, like those who received Pfizer or Moderna.
La situation actuelle reste préoccupante. On l'a toujours dit, c'est préoccupant. Il y a beaucoup plus d'infections depuis ces derniers jours et ces jours. Les touristes peuvent toujours entrer. Ils sont les bienvenus. Ils arrivent, vaccinés ou pas. Il n'y a pas de quarantaine pour eux. Ils peuvent circuler entre hôtels, entre îles, sans aucun problème.
So my message to all leaders is concentrate your efforts on suppressing the disease and concentrate your efforts in rescuing the situation of people and businesses for your economy also to be able to survive and then to recover when the time comes.
At a funeral home in Mexico City, every possible precaution's taken to protect the living as the last rites are given to the dead. Hearses sprayed as body bags are removed, everyone in full PPE.
This cemetery used to bury around 5 people a day. Now it's running at capacity, 24 hours a day, at least 25 bodies. And this is just the latest COVID-19 victim to be entered.
And Rodrigo knows. He brings the bodies to the crematorium with his uncle. They used to bury the dead here. Now they're mostly burned.
We're going through a very difficult situation, but someone has to do the job. Please stay at home. Don't go out if you don't have to. For now, the hugs are only from afar. We have no contact with our family, and that's a very painful thing.
As COVID-19 barrels through parts of Latin America, Mexico finds itself at the forefront of a losing battle until there's a vaccine. Mexico has just had its deadliest day yet. More than 6,000 deaths reported overall, and the bodies are piling up. A damning investigation by an anti-corruption group here claims the real death toll in the capital alone is perhaps 3 times higher than is being reported. But in parts of Mexico, you don't need to look very far to see the devastating toll of this virus. Funeral homes working in overdrive, and some crematoriums are now operating 24 hours a day, 7 days a week, and met with 2 men doing the grimmest of jobs in the hardest of times. Juan Carlos and Victor Manuel are cousins putting their lives on the line. But like so many Mexicans, with the economy so bad, they can't afford not to work. Patients come here, he says, and I tell them it's probably COVID. They say no, the national government made that up. It may be difficult getting people to take the virus seriously when testing is so low. Mexico's performed relatively few, approximately 150,000 for a nation of 125 million. And on the US-Mexico border, new concerns that the virus could peak again in Tijuana.
They didn't pull me aside. They don't stop you. They don't do anything.
Despite an agreement between the US and Mexico in March to limit traffic between the two countries, thousands of people have reportedly continued to cross the border daily. Like elsewhere, COVID-19 has had a disproportionate effect on the most vulnerable. Those who work in this emergency operations center say the crisis is not even close to being over.
But the pandemic emergency, it's not going to end. Not next week, not next month, probably not even this year.
Clearly, this Delta variant is much more transmissible than the Alpha, which most of it's replacing. It's something like 60% more transmissible, and now looking at an R0, an average infection rate of perhaps as high as 6 for each person who's infected with Delta. So clearly this is going to become the dominant strain worldwide. But the Delta variant is already pretty contagious, and I'm not sure if the next variant will be more contagious, but it would be, that would be worse if it was, obviously. At a R0 of 6, 6 people per infected one, that's already tricky. This variant is transmitting more by aerosol than the Alpha variant. So some of those containment measures that we've been looking at, such as hand washing, are less effective against this Delta variant. So it is a worse one. And this Delta variant is also a bit more resistant to the vaccine.
The U.S., the most vaccinated large nation in the world. Dozens of countries are now working to vaccinate their populations in an effort to end the global pandemic.
The federal government can require vaccination and things like that for coming in and out of the country. Both the state and city can have vaccine laws based on their legislative authority.
Requiring a vaccine is a health and safety work rule, and employers can do that.
So can you actually be forced to take the COVID vaccine against your will in the United States?
To be clear, the White House's chief medical advisor has already said that he doesn't think the federal government will ever make the COVID vaccine mandatory. However, powers at the city and state level, not to mention the legal rights granted to employers under U.S. labor law, may make it pretty difficult for some Americans to evade inoculation against the coronavirus. The very first school vaccination mandate was in Massachusetts back in the 1850s. It was to protect against smallpox transmission. By the start of the 20th century, almost half of all states required students to be vaccinated before matriculating. In the early 1970s, schools with a measles vaccine mandate had incidence rates that were up to 51% lower than states without the laws. And from there, school vaccine mandates expanded over the next few decades. In 1905, the Supreme Court case of Jacobson versus Massachusetts set the legal precedent which now allows states to require vaccines.
The Supreme Court said, yes, you can limit individual rights to protect the public health, and one way you can do it in that case is require vaccination.
We've seen states exercise this authority to varying degrees in the years since. Take, for example, the 2019 measles outbreak in New York.
New York imposed a mandate. It imposed an MMR mandate, but it limited it to the neighborhoods where the measles cases were high, and it was accompanied by a $1,000 fine for those who did not have MMR.
Legal experts say that narrowing the vaccine mandate to particular zip codes made it easier to justify in court rather than a statewide mandate. But critics warn that these types of targeted requirements may lead to discriminatory practices.
In general, these things are done at the state level, but big cities, for example, also have vaccine laws. When I was the city health commissioner in Washington, D.C., although that certainly functions as a state, we also had vaccine laws in Washington, D.C.
Another major factor to consider, none of the 3 COVID vaccines in circulation here in the U.S. are fully licensed by the FDA. Instead, they are all cleared under something known as an emergency use authorization, or an EUA.
Until they are officially approved, mandates seem to be off the table.
Mandates to some degree depend on pretty widespread compliance. You can't enforce a mandate if 40% of your population is fighting back. If the problem is widespread mistrust, mandate won't fix it. You need communication, you need education, you need to earn the people's trust by transparently showing them that the vaccine is safe and effective.
Location, and it's safe because all employees have been vaccinated. That's particularly important for restaurants, bars, gyms, and salons. And
so they're not a fully licensed product. So the ability to require your employees to be vaccinated will be highly controversial. In fact, I would argue that an employer cannot require you to be vaccinated with anything other than a fully licensed product.
Mandatory vaccination protocols, therefore, may have to wait until the FDA completes the entire approval process for the COVID vaccines.
2 fish burritos with the works. In restaurants and offices, come June 15th, it will be 100% vaccinated or 100% masked. That's the new rule approved last night by Cal OSHA.
For indoors, those vaccinated employees do not need to wear a face covering in a room where everyone is vaccinated.
But if someone in that room is unvaccinated, everyone in that room must wear a mask. And that's changing the plans of some CEOs.
If you want to go into the office and hang out with your coworkers, here's what you got to do.
They tell us they're ready to follow the rules and only dismiss masks if everyone in the office is verified as vaccinated.
I think we do have to kind of follow the protocol because we do want to keep people safe and healthy. So ultimately, the goal is really to keep folks safe.
As for employees heading back to the office,
first of all, I believe that vaccination should be personal choice and it should not be enforced.
Mixed opinions.
Most of the employee being vaccinated will make everybody feel comfortable and safe.
But in an area known for a high percentage of vaccinated people, those who run the businesses say they'll aim for safety first.
I just want to go in the positive direction. You know, we have come very far and we would like to take, small steps.
And one more stipulation from Cal OSHA, starting August 1st, employers will have to provide N95 masks for their employees in the office. They're not forced to wear them. They just have to have them in case.
The latest severe cases brought on by the Delta variant are just one of many reasons more and more businesses and employers are requiring vaccinations. The largest private employer in LA County, Kaiser Permanente, just announced its vaccine mandate. Employers weighing whether to require vaccines. Today, Kaiser Permanente announced it will require doctors, nurses, and all staff to get the COVID-19 vaccine. However, an Oregon law prohibits an employer to require an employee be immunized.
Monday, Kaiser Permanente announced a new mandate for all employees, making it a requirement for everyone to be vaccinated against COVID-19. Kaiser says more than 95% of its physicians are already fully vaccinated.
From hospitals to Hollywood, the list of businesses and employers requiring vaccinations is trending up. Lisa Vanderpump's Pump Restaurant, TomTom, and Sir, the latest to announce starting Wednesday you must test COVID negative or show proof of vaccination to enter. And now, Southern California's biggest employers are also taking a stand.
There is just no question that the vaccines protect.
Today, Kaiser Permanente, LA County's largest private employer, announcing it will require its employees to be fully vaccinated. While 95% of its physicians are already, Kaiser says staff vaccination rates are lower at about 78%.
We do want to take a stand that it is the right and necessary thing to do.
This as COVID hospitalizations in LA County are increasing daily, now surpassing 1,000. Doctors say most COVID cases right now are among the unvaccinated. Pediatricians say they're seeing an increase too.
Hospital environments should be as safe as possible, so that would mean vaccinating as many people as possible inside the hospital walls.
As COVID cases continue to surge in Oregon, it's time to change the state's vaccination policy. A 1989 Oregon law makes it the only state in the country where it's illegal for employers to require vaccinations. Today, the Washington State Hospital Association said it's urging hospitals across the state to require employee vaccines.
This is a big deal. We understand that vaccine requirements are controversial. But we think it is the right thing to do.
When Kaiser Permanente announced this afternoon all employees will have to get the jab, we asked how they plan on going about that at their Oregon locations, given the law. They told us in part, quote, "We are working with the Oregon Health Authority and the governor to support vaccinations to the fullest extent permitted by law. We reached out to Governor Brown's office about it. They told us conversations with stakeholders on this subject are continuing, including with Kaiser Permanente."
For other employees, the number that are fully vaccinated drops to 78%. The news comes as COVID-19 cases are going back up. Dr. Nancy Jin is a regional medical director for Kaiser. She says the decision was made for safety first, but also to set an example. Dr. Jin points out that there are other requirements healthcare workers must follow that have existed for years.
Things like getting an annual tuberculosis test, getting your measles, mumps, and rubella vaccine, or hepatitis B vaccine.
In New York, a group, including healthcare workers, protested a similar mandate for vaccines. One nurse saying she didn't oppose FDA-approved vaccines, but thinks people shouldn't be forced.
Hospitals are already short-staffed, and this is the hill we will die on. We're not playing games.
Here at home, the president of the California Nurses Association says they agree that vaccines are the best protection, but want other safety measures as well.
Making sure that we have the appropriate PPE, COVID testing, notification, contact tracing, masking.
Kaiser is allowing employees to apply for vaccine exemptions if it's for medical or religious reasons. The deadline to be vaccinated is September 30th.
Hospital giant Kaiser Permanente, the latest to mandate COVID-19 vaccines for all employees and physicians. The massive healthcare system is the largest non-government employer in LA County. The move comes as COVID cases across the country continue to climb. Over the weekend, more than 100,000 new cases reported, the highest daily number since February.
This remains a pandemic of the unvaccinated, where the vast majority of spread is in this country is among those who are unvaccinated.
Nearly 80% of U.S. counties reporting high or substantial community transmission. Hospitals in hot zones like Louisiana with the highest COVID infection rate in the country running out of beds.
These are the darkest days of this pandemic. We are no longer giving adequate care to patients.
Federal disaster teams now called in to help. While the U.S. has finally hit President Biden's goal of 70% of adults partially vaccinated, 90 million Americans eligible for the vaccine have yet to get a single shot.
It's very much a concern because the D variant, we've got a relaxation of social distancing, not using masks, that has caused this resurgence.
See, that was it. Pop-up sites like this one in Arleta helping to bring the vaccine to the community. But the growing concern is for those not yet eligible for the shot, as millions of kids are set to return to school.
Good morning, welcome.
San Bernardino City Unified School District beginning its fall semester back on campus with extra safety precautions in place.
But the message that they are trying to put out there is very clear. They say that they do not trust the vaccine.
This is my passion. This is my life.
Karen Helms has been a nurse for 30 years, but now that her employer says she has to get vaccinated, she's willing to walk away.
Yeah, it was a no-brainer. I'm still not taking it. You know, my husband is backing me 100%. I will find something else to do. It may not even be in the healthcare business.
Helms organized this demonstration with dozens showing up to have their voices heard. Cheryl Morneau is also a nurse and says she's okay with putting her job on the line. outside.
It's not right for us to be told that we don't have a choice or we lose our job.
I asked these nurses what it'll take for them to get the vaccine. They both said time.
I am not anti-vaccine. All my kids are fully vaccinated, but this one's new.
We need more time. Don't mandate this now. Let's give it some time. Let's see how it works.
There are mounting concerns over rising COVID cases in several states, even as vaccinations ramp up across the country. U.S. health officials warn a fourth COVID surge is on the horizon as the UK variant spreads nationwide. The head of the National Institutes for Health tells CBS this morning the variant is probably, quote, 70% more contagious and significantly more lethal even for young people.
Correct. It is unlikely that we will eradicate this, at least not in the near future, because of its widespread global spread that we have. That's not going to happen. You can possibly eliminate it if, in fact, you vaccinate enough people and you get the overwhelming majority of the population vaccinated and you do get this veil of or umbrella of herd immunity. One of the stumbling blocks to that is that this is a global pandemic. So unless you essentially equally suppress it throughout the world, or if you have places in the world where it still is pretty much doing its thing without any control, you will always have the danger, even if you do a good job in the United States or Canada or the European Union, that if you have parts of the world where there's a lot of viral activity, the idea of a variant emerging, getting to your country, and then re-giving you another spike is a real danger. So in answer to your specific question, it is conceivable that until we get a broad array of protection throughout the world, that we may have cycles where we'll have to keep boosting people, either boosting them with the original vaccine, which gives you enough antibody to spill over to the variants, or develop a vaccine that's specific for one or more of the variants. The only trouble with the latter is that otherwise you may find yourself playing whack-a-mole with the variants, because we have a lot of different variants. One was the UK, another one was a South African variant. We now have a couple of homegrown variants, one in California and one in New York. So what you really need to do is to get a vaccine that's potent enough and broad enough that it will overlap all of the other variants. You can give that a name, more of a universal SARS-CoV-2 vaccine.
A virus will not mutate unless you allow it to replicate. So if you allow the virus to freely circulate and not try and stop it, sooner or later there is a likelihood that you will get another variant that could, I'm not saying it will, that could be more problematic than the Delta. Fortunately for us, the vaccines do quite well against Delta, particularly in protecting you from severe disease. But if you give the virus a chance to continue to change, you're leading to a vulnerability that we might get a worse variant, and then that will impact not only the unvaccinated, that will impact the vaccinated, because that variant could evade the protection of the vaccine. So people who are unvaccinated should think about their own health, that of their family, but also the community responsibility to crush this virus before it becomes even worse.
As Americans face infection and hospitalization at a staggering rate, tonight new findings from the CDC say the war has changed in the battle against COVID. New data made public today likens the Delta variant spread to the chicken pox. As the virus leaps person to person, it's more contagious than the common cold. Likely triggering more severe disease than previously known, the Delta strain is also infecting the vaccinated at higher rates, as they carry similar viral loads in their nose and throat as the unvaccinated. And while they too may easily spread the virus, the inoculated are rarely hospitalized. Despite the spike in cases, it's important to remember we are nowhere near last winter's surge in cases or the daily death count. Still, with the new data providing some confidence concrete numbers on breakthrough infections, the concerning findings are why the CDC called for the vaccinated to also wear masks indoors in high-risk communities earlier this week. But scientists recommended the CDC go further, saying universal masking is essential. As Disney and Walmart add vaccination requirements for some employees, the CDC is still struggling to convince some Americans to wear a mask, much less get vaccinated.
Miguel, I have to ask, with cases trending in the wrong direction, has there been any talk of possible lockdowns?
Well, Lester, the White House said there would not be a return to any lockdown, that vaccines can stop the pandemic. And
according to the New York Times, management teams are faced with tough decisions about reversing reopening plans or whether to implement vaccine mandates for employees as the highly contagious variant continues to spread. Many companies like Apple and Google have already delayed their return dates until later this year. But ride-sharing app Lyft has pushed its return date to 2022.
The death and infection rates are so low, such a small percentage of our population that, they don't warrant mask mandates or vaccines. Isn't what's at stake here the healthcare system at large? I mean, doctors, staff, nurses, PPP. I mean, you were telling us it's harder now than it was a whole year ago.
Okay, first of all, big picture. A year ago to now, we're a lot better now. So we have this amazing vaccine. We know from the aerosol scientists, which is so important, about the importance of ventilation. Why is that important? Well, a year ago, I was wearing a mask outdoors. Now, I know if I'm a distance from people outdoors, I'm fine. It's like infinite dilution out there. We know that masks are important, that they work, they're a therapeutic. So we're different now than a year ago. But in terms of the nitty-gritty of what you do indoors, it depends on where you are and what your risk tolerance is. Because if you're in a place which is hot and you go indoors and you're vaccinated, remember that the advice back in May was you didn't have to wear a mask, right? Back then, Delta was 1%, and we thought that if you got infected, if you did get a breakthrough infection, there wouldn't be enough virus in your nose in order to spread it to somebody else. Now it's more than 90% Delta. We know from the outbreak in Provincetown that, in fact, you can get a breakthrough infection and have enough to probably spread it to other people.
Extra steps is the idea of whether you call it a supplemental or a booster shot for the immunocompromised. Where are we when we might see that as well?
Well, the FDA is not waving me off from the idea that I floated that next week we may get advice about people who are immunocompromised, whether they should get another shot. Because we know, we did the story here, that people who are immunocompromised, for example, you've had an organ transplant, you're on Cellcept or some other immunosuppressive medication, and you get the vaccine, you may not have as robust an immune response. And we're showing that those people, in fact, probably do need to get another shot. So stay tuned pretty quickly.
I'll wear masks to not get somebody else sick. So it's not a big deal to me.
Sue Hodgkins continues to wear her mask in public despite COVID-19 restrictions being lifted. While she and many Angelenos have been vaccinated, concern is growing about the Delta variant that is stronger and spreads faster. LA County health officials say COVID-19 cases hit a new high since April, more than 500 positive tests in a single day. Officials say it's more important now than ever to get vaccinated.
Viewers are now asking, first, if asymptomatic people would test positive, and second, do asymptomatic people just keep spreading it like Typhoid Mary, or do they stop at some point? The first answer is yes. If for some reason an asymptomatic person was tested and they were shedding virus, they would test positive. But my answer to the second question is really much more complicated. The short answer is yes, they will stop spreading virus at some point. But these questions really highlight a real issue. This area hasn't been studied well enough yet because we haven't done comprehensive surveillance of asymptomatic individuals. And we have yet to identify a reliable antibody test that can tell us if a person has recovered and is immune. Now, another question that several people are asking is whether it's possible to be infected with another virus while you have COVID-19. And the answer is yes. In fact, a study that was just published in JAMA specifically found 20% of people that are positive for SARS-CoV-2 were also positive for another virus. Now, the most common other virus types were rhinovirus, enterovirus, RSV, and non-SARS-CoV-2 coronaviruses. All of those are frequent sources of the common cold.
The county says a majority of the people who live here are already vaccinated. Of the 1.5 million people who live in Alameda County, the county says more than 1 million people already got the shot, but they say more still needs to be done. Keep in mind, California is imposing a first-in-the-nation vaccine mandate for state healthcare workers. They have to be fully vaccinated or received their second dose by September 30th. That order came down yesterday and applies to workers at all hospitals, skilled nursing facilities, and other healthcare facilities.
It allows people who are exempt to continue working as long as they get tests and wear masks. So the accommodation is you don't have to vaccinate, but you do have to test or wear a mask. And yes, it's probably legal.
Hey, Wavy in his bag, yeah.
200 million shots in 100 days, in under 100 days, actually. It's an incredible achievement for the nation, and here's the context. Some experts say that the rapid vaccination effort has already saved tens of thousands of American lives. We'll never know exactly, but we know it saved lives that would have otherwise been lost. I'm proud of this is an American achievement, a powerful demonstration of unity and resolve, what unity will do for us, and a reminder of what we can accomplish when we pull together as one people to a common goal. Now that we've reached this milestone, we're entering a new phase of our vaccination effort. As of Monday, in my direction, with the support of 50 governors, Democrats and Republicans alike, everyone over the age of 16 will be eligible to get vaccinated. Now our objective is to reach everyone over the age of 16 in America. Wherever you live.
Herd immunity means if enough people get sick and recover from an infectious disease, their immunity will keep the virus from infecting others. But you need huge numbers of people to get sick to achieve that. Estimates for coronavirus range from 60 to 80% of the population. Herd immunity has never been achieved without a vaccine. And even with a COVID vaccine, it's not clear how strong or how long immunity will last. The death toll would be just as devastating. Using the latest numbers from Johns Hopkins of more than 8 million COVID cases and nearly 220,000 deaths, the death rate is over 2.5%. Even if we only need 60% of the population to achieve herd immunity, that would still mean more than 5 million deaths from COVID-19. But even the most conservative estimates are that a herd immunity strategy would mean at least another 500,000 dead Americans, most of which would likely come from minority communities and the elderly.
I can't breathe! I can't breathe! I can't breathe! I can't breathe! Those were the last words George Floyd ever spoke!
Today, protesters vented their frustration over the deaths of Black Americans at the hands of police, and they promise to be back out tomorrow demanding change.
The key is getting the monoclonal antibodies early, within 7 days of developing mild to moderate symptoms.
It attacks the virus, so you want to get it into you early on, within 7 days of when symptoms appear, and it's particularly useful for people who need a little help with their immune system.
Monoclonal antibodies are man-made proteins that act like antibodies in your own immune system, neutralizing the virus and keeping it from infecting your cells. Patients who receive the hour-long infusion of monoclonal antibodies report feeling better in 24 to 48 hours.
This is a very different variant than what we've dealt with previously.
As variants spread, the president's push to get people vaccinated rolls on.
It's moving like wildfire through the unvaccinated community. And it's heartbreaking.
Confusing.
Americans have received far too many mixed messages and muddied communications about masks, vaccines, and what risks remain and for whom.
The White House argues the science of COVID is black and white, not red and blue. So they're upset with resistance to new CDC guidance about masks for school children or for the vaccinated in Texas and Florida. In New York, Mayor Bill de Blasio is now hoping to ban anyone unvaccinated from doing pretty much anything indoors.
You'll have the key, you can open the door, but if you're unvaccinated, unfortunately, you will not be able to participate in many things.
The president mistakenly said that some states are offering up to $100,000 to get a vaccine shot, and he later corrected himself to say it's just $100, but that if it was $100K, he would have gone back to get vaxxed 3 times.
As the pace of vaccinations has slowed down in recent weeks, California is shelling out big cash incentives to get people to roll up their sleeves.
Yeah, we're talking about $50 gift cards, even the chance to win more than $1 million. But is it enough to convince people?
The state is now giving out $50 gift cards to the next 2 million people who get the shot. The state is also doing a vaccine lottery. 10 people will win $1.5 million each, and 30 people will win $50,000 each.
I'd get the vaccine, cash or not, because I want to go back to normal.
California health officials say 12 million people who are eligible still have not gotten a shot.
There's no amount of money that's going to change my mind about putting something in my system that hasn't been tested.
Many COVID vaccine skeptics believe the lottery money is wasteful and will only intensify the shaming and add pressure for people who don't want it.
I have lost a few friends. I've been told, they don't want to talk to me anymore.
Some people worry if they go public, they could lose their jobs.
Why the government would have to coerce people, that would be my question. And this is taxpayers' money.
Even though health experts have repeatedly said the vaccines are safe and effective, for some people, nothing will change their mind.
I'm going to let all the other guinea pigs go in front of me first.
More states have decided to have lottery jackpots for people who get their COVID vaccine. New York will offer a Vax and Scratch promotion that awards lottery tickets to people 18 and older. And in Maryland, anyone who is vaccinated will automatically be entered into a daily lottery. The grand prize drawing will be for $400,000.
But there are also millions rejecting it.
I'm not getting the vaccine because I'm honestly not scared of the virus.
I don't trust the vaccine at all. I don't think that it's 100% safe and effective. And I believe that the risk is worse than what the benefit would be.
You're concerned that
you're right. We need about 80% at least of the population to be immune.
For me, as a scientist who's also a Christian,
This is an answer to a lot of prayers.
Public health officials are targeting conservative media, and a new public service announcement features former presidents, including Republican George W. Bush.
It's important for our fellow citizens to get vaccinated.
Now, if you've been feeling sick and experiencing signs of COVID-19 but test negative for the virus, you're not alone.
Medical experts say there are people who have tested negative for COVID-19 multiple times who then suddenly test positive.
Conversations I had with several nurses who work at a nearby hospital. In fact, one of the nurses told me about a patient who had all the signs and symptoms of COVID-19, tested negative 3 consecutive times, then on the 4th test, finally tested positive. A health official I spoke with from the health department says there is a reason why this is happening.
While hundreds of people continue to line up each day to be tested for coronavirus, some may be getting their results and asking, how did they not test positive when they know they are experiencing symptoms of the virus or they know they have been in contact with someone who is infected?
Only had 200 thought they had COVID-19. Turns out a local testing lab got it wrong. Got them all wrong. The results even...
Star Lab in Franklin Park advertises one-day turnaround COVID-19 tests. The website even guarantees accuracy. But the Illinois Department of Public Health says they found out today that Star Lab reported 325 potentially false positive COVID-19 cases. And just last week, Star Lab had more false positive problems. The owner points to a computer glitch while processing nearly 900 COVID tests. Internal emails revealed the glitch wasn't detected until 189 of those tests were sent off as false positives.